Hello, my name is Professor Sharynne McLeod from Sturt University, and I'm very honoured to present this presentation to you for the Early Childhood Voices 2022 conference. My presentation is titled Speech Intervention for Rural Australian Children, and I'm presenting on behalf of my colleagues Kirrie, Beena, Ahmed and Kirrie Ballard. To begin, I need to acknowledge the traditional owners of the lands on which we meet today and pay my respects to elders past, present and emerging. I also would like to disclose a few disclosures for this presentation. Although I have no relevant financial disclosures, my colleagues Kirrie Ballard and Beena Ahmed are co-founders of Say 66 and developed the Say Bananas program that we're going to be talking about. Professor Ballard was awarded an AMP Tomorrow Makers grant to fund the research through Say 66, and she collaborated with us and through Enhanceability, who employed Kirrie, to undertake the research in rural New South Wales. So let's begin. While many children learn to speak intelligibly, at least 8% of children have speech sound disorders that can impact their ability to communicate with those around them. There are many ways that we can support children who have difficulty speaking. However, the best way and the most efficient and effective way is to undertake frequent, high-intensity and individualised interventions that actually require 3 or more sessions a week. Children need to practice the motor skill of moving their tongues to consolidate these new skills. In Australia, speech therapy typically only occurs once a week, and in fact, sometimes in some states and some jurisdictions, only in 6-week blocks. So, children require daily home practice. One of the problems is that it's really hard to practice something that's difficult to do. So, we need a solution. Computers can offer a bit of motivation for children, and there's been a systematic review to say that computer-based interventions are effective for children with speech sound disorders. My colleagues and I have undertaken 3 different studies to explore computer-based interventions for children with speech sound disorders. We've undertaken 2 randomised control trials that demonstrated no significant difference between the computer-based intervention and the control group. These 2 studies actually did not have production practice that enabled the children to practice the sounds. They were more ones where the families and educators worked with the children to listen and to do more general practice. One study, though, using Apraxia World, demonstrated significant change in children's speech. Now, Apraxia World is now called Say Bananas, and it was collaboratively designed with children, their carers and speech pathologists, and the children were over 8 years of age. It's a bright 2-dimensional Mario-style platformer game, where players actually control a monkey avatar to navigate the platforms, collect items and fight enemies as they work to get across the finish line. There are actually 40 levels, 8 levels in each of the 5 worlds, with 7 different characters and an in-game store. Lots of fun for kids. The best thing is that Say Bananas has been developed by speech pathologists to enable intensive speech practice. When the player gets a star, the game actually pauses and a themed speech exercise pop-up appears. The child plays the example, has to record their speech. You can also go back and listen to the recording, and then eventually there'll be an automatic pronunciation evaluation. At the moment, the version that we used was a beta judgment about whether the child said the speech sounds correctly or not in order to win the prize. A previous study was undertaken using Say Bananas with 10 children. During this study, the children initiated home practice. They wanted to play the game. The parents said that it fitted easily into daily life. They felt confident using it and were satisfied with their child's speech progress and would like to use it in the future. The children averaged 81% of the recommended practice over the 4 weeks of therapy, and the average magnitude of treatment effect was comparable to face-to-face speech therapy. So, suggesting that it was now time to do an effectiveness study. So, we undertook this study to determine the effect of the Say Bananas on rural children with speech sound disorders. This was actually done at a time during COVID lockdown when many rural children could not attend any speech therapy, so it was really welcomed by the families. The usability, accessibility and rating of Say Bananas with these rural children with speech sound disorders and their parents was also examined. To be eligible to participate, the children had to be between 4.5 years of age to 12 years of age and attend mainstream schooling and live in rural Australia. And they lived across many of the states of Australia. They had to present with a speech sound disorder, either mild to severe, and that means they have difficulty producing speech sounds and many were quite unintelligible. They had to have sufficient hearing and vision and fine motor skills to use the Say Bananas app. At least one parent had to be a speaker of Australian English and they had to have home internet access. We received ethics approval, also asked for parental consent and explained it to the child and asked for their assent before we undertook the research. It was a mixed methods study. We recruited 68 children and 62 passed the eligibility screening. Then the parents completed a questionnaire and we undertook a pre-intervention assessment. Only 45 were available for that assessment, although we did it online. And this was often due to difficulties with the COVID pandemic and the various lockdowns that were occurring. Of the people that were assessed, 29 were able to undertake 4 weeks use of Say Bananas that was remotely supervised by a speech pathologist. And the post-intervention assessment and interviews were undertaken with 21 children. So the remaining information we will report on are the 45 children, and they were aged 4 years, 4 months, so we ended up getting slightly younger for one of them because they were a sibling, to 10.5 years, from rural New South Wales, Queensland and Victoria, the eastern side of Australia. So the results are, on average, 21% of children completed 44% of the recommended practice or dosage. The recommended dosage was 100 trials a session and 4 sessions a week. So over 4 weeks, we wanted children to say 1,600 words. The actual dosage was about 698 words over 4 weeks, but one of the children actually had 3,000 words that they produced. They were so enthusiastic about practicing, something that very rarely happens in other ways of encouraging children to do their speech practice. To look at the outcomes, there was actually a significant change in children's percentage of consonants and vowels and phonemes correct over time, particularly their percentage of consonants correct, which is the one on the bottom side. We used the 54-word international speech screen for that. The children's intelligibility did not show a significant change over the 4 weeks, and neither did the children's feelings about their talking. They still had the same feeling about how they spoke at the end of the 4 weeks. But when we asked them, how the Say Bananas app was going, they were extremely positive throughout the intervention. They had said a mean of 4.24, which was happy, good and fun. And then at post-assessment, it was very close to that as well. So the kids were saying to us that they did enjoy participating. We asked the parents to use the mobile application rating scale, and 15 parents were able to complete that and gave a subjective overall rating of 4.15 out of 5. They also rated highly engagement, functionality and the aesthetics of the game. Functionality was the lowest average score, and that was still 4 out of 5. We also asked the children to draw themselves playing Say Bananas because we wanted to get a sense of what the children thought was important and what they remembered and what they enjoyed. So we asked them at the end of it. 6 of them drew themselves smiling out of the 9. A couple didn't draw themselves smiling because they drew the back of their heads. And they all demonstrated that they'd engaged with the app. In fact, 8 drew a tablet and most included the monkey, like this little girl who drew her mother watching her play, and the monkey is on the screen. Here are 2 other drawings from the participants, and you can see that they've actually drawn the tablet, and the one on the right-hand side has drawn his fingers holding the tablet and the buttons A and B and the monkey in between. So it really showed the stars, the coins, the big tree and so forth. They were really aware of all the features of the program and of practicing. So it showed that they really had engaged with the app. When we interviewed the families, 21 interviews were undertaken with carers and children. The siblings were interviewed together. We had 2 pairs of siblings, and the interviews were guided by the questions by Hare et al. From 2021. There was a lot of enjoyment and engagement. When we said, how do you feel about Say Bananas? And they were pointing, the children said, that one, extremely happy. The parent said he absolutely loves it. He has dreams about it. And then the child said, I imagine I was on the 4th level trying to get the baddies. And then the parent said, sometimes it's the highlight of his day. And there were many parents and children that talked about the program like that. And it's a fairly rare thing for children to talk about practicing their speech sounds as the highlight of their day and something that they dream about. The parents were generally highly enthusiastic. One said we would sign up for life, but one actually wanted his child to be more independent. He said it was difficult because you have to sit with him the whole time and do it. So it's not something he can just go and do himself. He found it a bit hard too. Now, it was interesting because from a speech pathologist and educator's perspective, we love the parents to share the experience with them. So we found it quite helpful to know that some of the parents just wanted the children to get on and practice themselves, and that's where the automatic speech recognition will be quite helpful. There were only a few suggestions. Most enjoyed it. Some children were frustrated progressing through the levels of the game, and one child really wanted to have dinosaurs as well as monkeys. So to conclude, Say Bananas appears to be effective for engaging rural Australian children with speech sound disorders and for improving speech accuracy. It potentially provides a viable solution for overcoming equitable, timely and cost-effective access to speech pathology practice for rural families. It certainly doesn't take the place of attending speech therapy, the assessments and the goal setting, because each program was individualised for the children's target goals and what they needed. But it certainly enables children to get a lot of practice. So thank you very much for listening to our presentation about speech intervention for rural Australian children.